One of my favorite things to do as Dr. Nacho or Dr. Paul Goodman is to teach dentists how to place their first dental implant. Now, dental implants for the general dentist is totally possible, but what is important for me is that dentists learn in a responsible way. So in dental school, you learn how to do some root canals and you refer some root canals. You learn how to see some kids, and then you refer the ones that are screaming and hanging on to their mom's leg. With implants, we have this all or none philosophy. So through my training, back when I was in my GPR 15 years ago, I was lucky to place over 100 dental implants as a general dentist. And I took that training and wanted to teach other general dentists or any dentist how to place their first implant and get started in the right direction. So the courses that we run here in Philadelphia are super awesome because of a few things. It's a 3-day course. We run Friday, Saturday, Sunday. On Friday, myself and a periodontist teach you how to suture, how to make flaps. We practice on the models, and you can be a dentist anywhere in the country and join us in Philadelphia. On the Saturday, we take a party bus, an implant party bus, and we go to the state of Delaware, and any dentist with any US license can be in a training course in Delaware where I bring actual patients. So you take what you learned on Friday and you put it into action on Saturday on an actual patient. I pick cases that are great starter cases. To use an example of driving, where you're driving around a high school parking lot, make sure you can't hit anything. The excitement and energy that these general dentists get out of placing their first implant on a patient changes their life. It changes their life, changes their practice life, changes their patient's life. Then they go back to their practice and responsibly do starter cases. After they have mastered that, they will move along in a true crawl, walk, run type of learning. One of the challenges I see in the implant education world is that there's a lot of high level cases, but you're not even sure if you want to place implants all the time. So is it a waste to take a course if you're not sure if you want to place implants? Definitely not, because what you learn is how to talk to your patients about implants. And general dentists that can restore more implants can be more profitable, pay their loans back, grow their practice. So just the act of placing one dental implant on a patient makes you see dentists in a totally different light. So we have my first implant here in Philadelphia, so click on the link below. I would love to see you in Philadelphia and help you place your first implant.